Hi, my name is Vineet Arora and I'm the Division Director for Laboratory Services with the Kentucky Department for Public Health. Our mission is to promote and protect the well-being of public by providing high-quality and efficient laboratory services and education. We pursue this goal by being a reference lab with state-of-the-art instrumentation, ensuring continuous quality improvement, being responsive to public health needs, and playing a developmental and supportive role in public health initiatives. We are ready and available to respond 24/7 every day of the year. Division of Laboratory Services, or DLS, commonly known as Kentucky State Public Health Lab, performs over 3 million tests each year, and this includes sophisticated biological, chemical, and molecular lab testing. We collaborate with federal, state, and local entities, as well as universities and other divisions in the department and the cabinet to support critical activities like disease investigation, control, prevention and surveillance, food safety, and environmental health and protection. Leveraging expertise and resources, DLS serves as a center of excellence and as a reference center for hospitals and local health departments across the Commonwealth. DLS is a high complexity laboratory, obligating us to meet the most stringent technical and quality requirements. Being true to our values of integrity, quality, and accountability, we are regulated and inspected by multiple agencies, considering the wide array of testing we perform at DLS. Clinical testing conducted at DLS is regulated by CLIA, which is Clinical Laboratory Improvement Amendment Act, and we are accredited by the College of American Pathologists, which is considered the gold standard for clinical laboratory accreditation. We are accredited by International Standards Organization, or ISO, as a food testing laboratory with support from US FDA. Other agencies that routinely inspect and certify us are CDC, US Department of Homeland Security, US Department for Transportation, Environmental Protection Agency, and American Industrial Hygiene Association. With this background, let's talk about different areas within the division, and that will provide a sense of the breadth of testing carried out by DLS. In total, we carry out more than 3 million tests every year. On the microbiology side, DLS promptly and accurately detects and identifies a wide variety of microorganisms, which include bacterial and viral, that pose a threat to public health. These may include infectious agents related to foodborne disease outbreaks, seasonal influenza, high-risk and high-mortality diseases like antibiotic-resistant tuberculosis, hospital-associated infections, or infections like HIV, hepatitis C, and hepatitis A. This requires us to always stay at the cutting edge of technology. One such example is next-gen sequencing, NGS, or whole genome sequencing, for DNA fingerprinting of microbes. This technology has replaced conventional gel-based techniques to look for relatedness between organisms that are identified for human and food sources. This technology allows our epidemiology partners to pinpoint the source of infection and thus help control the outbreaks promptly and effectively. From preparedness aspect, DLS is constantly alert and prepared for situations where dangerous emerging infectious pathogens like Zika or Ebola virus are identified as potential threats to our citizens. In such events, DLS rapidly deploys methods for their detection. This is also true for hospital-associated infections, such as organisms that are highly resistant to antibiotics. These have been identified as major public health threats by Centers for Disease Control and Prevention, as well as globally. Timely and precise detection of these agents by DLS is critical for effectively limiting the spread and harm from these deadly infections. DLS is responsible for testing packages and substances with possible links to chemical or biological terrorism. This testing is carried out in a highly secure biosafety level 3 lab with specialized protocols developed by CDC as a part of Laboratory Response Network. These facilities and protocols are not available to other labs in the state. Furthermore, testing for low incidence or high-risk diseases such as botulism or rabies may be unavailable to public health sector, and DLS maintains the capacity and develops capacity for this type of specialized yet critical testing. In this sense, DLS truly serves as a reference lab for Kentucky. Continuing with other areas, as a part of environmental testing, the food, milk, and water labs at DLS test for environmental contaminants like pesticides in food or vegetables sold at local farmers markets, or bacterial contamination in commercial dairy products, or contaminants in recreational waters, thus contributing to the safety of the citizens of Commonwealth of Kentucky. We also perform chemical analysis in support of Occupational Safety and Health Administration, OSHA. The other end of spectrum of testing at DLS is for heritable conditions in newborns. These conditions may be undetectable by physical examination or by other clinical signs and symptoms. With guidance provided by the U.S. Department of Health and Human Services, DLS performs initial laboratory screening for the identification of metabolic, endocrine, hemoglobin, and several genetic disorders. Currently, the total number of disorders on the screening panel is 55, and we test close to 55,000 newborns each year for all these disorders. Timeliness is critical for newborn screening as there are treatments or preventative measures that work only if initiated early after birth. DLS works diligently with submitters and partners to deliver accurate and timely results for these critical and actionable tests. While we have talked about all the technical areas, none of this is possible without the support from very able people who work behind the scenes. These are folks in our business operations and customer service, those who work in the media room, autoclaving, container and glassware room, and rest of the support staff. At each step, they are key to seamless functioning of such a complex operation. This sophisticated and complex lab requires a team of highly skilled, talented, and motivated scientists and support staff. They are our biggest asset that we are extremely fortunate and proud to have as part of DLS, and I am proud and honored to be a part of this team.